Anxiety is an incredibly broad psychological term. In this video, we'll be focusing on hypochondria, also known as illness anxiety, a thin sliver in the anxiety spectrum. My name is Joseph. I'm a psychiatrist working at ePsychiatry here in Western Australia. We provide telehealth mental health services to people living in regional areas. In its broadest sense, anxiety is a stress response to a perceived threat. Anxiety can be triggered by very specific phobias, by social situations, or it can even be present in the background. Illness anxiety disorder is when you worry, become anxious about having a particular illness in the absence of signs and symptoms to confirm the disease. Illness anxiety disorder, formerly known as hypochondriasis. Hypochondria comes from an ancient Greek term and was discussed and written about by the ancient Greeks. So in illness anxiety disorder, you worry about having an illness. The worry is to the point of it becoming obsessive and consuming, which distinguishes it from normal concerns about one's health. Illness anxiety disorder is probably best explained with an example. Sometimes people worry that they have a certain condition, say for example a throat cancer. They may notice a certain odd sensation in their throat, which in their mind gravitates to it being a throat tumor or a cancer, leading to excessive repetitive thought patterns. The person then goes and gets checked by their doctor, has multiple blood tests, a scan done of their neck, and a camera test done, none of which reveal any signs suggestive of cancer. The doctor then tries to reassure the person that they aren't in fact ill. However, the person can't seem to acknowledge the explanation. Sometimes they may have a scan which shows a negative result, which may allay some fears for a couple of days, but then the anxiety gradually comes back. How illness anxiety presents differs from person to person. Some people get frequent blood tests, others perform irrational behaviors such as avoiding people and places due to fear of becoming sick. They might constantly search the internet about their illness and talk about it with people close to them. The exact cause for illness anxiety disorder is not known. However, several risk factors have been noted. Being misinformed, sometimes a false health belief, added to a bed of worry and stress is all that is needed to start a repetitive cycle of worries about one's health. You are more likely to develop unhealthy obsessions about your health if you have a family member who has done so before. You may have grown up in an environment where there was a lot of worry about health conditions. Family members having to go into hospital frequently, which impacts upon a child's way of coping and getting their various needs met. Other associated factors includes having personality traits where one has a tendency to overthink things, and also a history of abuse as a child have both been linked with illness anxiety disorder. Treatment for illness anxiety disorder involves a multi-pronged approach. There is some role for anti-anxiety medications. The cornerstone of therapy involves CBT, having people evaluate their thoughts and fears and replacing them with rational ones. It also involves learning relaxation techniques and mindfulness techniques and learning one's triggers. Sometimes a hypochondriasis can lead to frequent hospitalizations, excessive investigations, including repeated harmful CT scans and the purchase of costly medication and supplements. Often it helps to have a single doctor oversee and manage the care. Thank you for watching. This is the second of our three-part video series this month on anxiety. The final video will be on shyness and social anxiety.